Okay, let's talk about the treatment of heart failure. In this video, we will discuss the treatment of chronic heart failure, in which case the patient is stable because acute heart failure is a medical emergency that needs to be discussed in a separate video. Okay, a patient presented to you with symptoms of heart failure. The ejection fraction had been estimated by the echocardiography. Let's say it's 35%, and the patient is complaining from those symptoms of dyspnea, fatigue. Now you want to start your treatment. The treatment of heart failure is directed towards the compensatory mechanisms that had aggravated the heart failure, which we have discussed earlier in the previous videos. And you remember those two mechanisms are the increased sympathetic activity and the activation of the renin angiotensin aldosterone system. So, the first group of drugs to be used in heart failure are those targeted against these mechanisms. So you start your treatment with two drugs. The first one is an angiotensin converting enzyme inhibitor, and the second one is a beta blocker. Angiotensin converting enzyme inhibitor, as the name suggests, is for the activation of the renin-angiotensin aldosterone system mechanism. You remember that in this mechanism, angiotensin 1 was converted to angiotensin 2 in the lungs by an enzyme called angiotensin converting enzyme. So, when we block these enzymes, we will block the release of angiotensin 2, which was a potent vasoconstrictor that increased the afterload, and we will also block the release of aldosterone, which increased the preload. So, this group of drugs include enalapril and anything ends in pril. Those are the first line for the treatment of heart failure. Also, with these drugs, we start a beta blocker. This drug will decrease the workload of the heart. But these two drugs need to be used in low doses initially, because angiotensin converting enzyme inhibitors are known for the adverse effect of first dose hypotension, that when the patient takes the drug for the first time, he experiences symptoms of hypotension, and so they must be given in low doses and once daily when the patient goes to bed. And the beta blockers also must be used in low doses, because if we start with a large dose, this will stop the heart completely. So this will aggravate the heart failure. Okay. These two drugs, especially when used in combination, will decrease the mortality from heart failure. They will improve the survival of the patient. And this is a very important point and highly tested in the exams. Okay, now what are the main side effects of angiotensin converting enzyme? As we said, first dose hypotension is the main side effect. We also, the patient may complain from cough, and this is the main reason for non-compliance with angiotensin converting enzyme inhibitors. Cough is due to increased level of substances called bradykinin. The angiotensin converting enzyme also destroy these substances. These are pro-inflammatory substances that, when released in the lungs, will precipitate the cough. So when we block angiotensin converting enzyme, the level of bradykinins will increase and cough will appear, or the patient will complain from it. And the third main side effect is hyperkalemia, and this is due to decreased level of aldosterone. Now, aldosterone is the hormone that removes extra potassium from the body, so hyperkalemia will result when we use angiotensin converting enzymes. Okay. Main contraindication for angiotensin converting enzyme inhibitors is the patient with bilateral renal artery stenosis. These drugs should not be used in those patients, and also for pregnant women, angiotensin converting enzymes inhibitors are contraindicated. Okay, now, not all beta blockers work for heart failure. There are mainly 3 beta blockers that work for heart failure, and these are metoprolol, bisoprolol, and carvedilol. These 3 drugs, 3 beta blockers, are mainly used for heart failure. Okay, now you give your patient these 2 drugs, and you tell him to come after a week. After a week, the patient will come with one of 3 scenarios. Either the patient's symptoms are improved and he has no side effects, and we said the main side effect the patient will complain from is cough. If the patient improves and there is no cough, you can start to slightly increase the doses of these drugs until you reach your target dose. Or the patient will be presented with improvement of symptoms, but he complains from excessive aggressive cough that he cannot take the drug anymore, in which case you must shift the patient into another drugs, and these are nitrates, isosorbide dinitrate, and hydralazine. These 2 drugs are actually potent vasodilators. They work directly on the vascular smooth muscle, causing their relaxation, and thus they will reduce the afterload and the preload. Hydralazine mainly works on arteries, whereas nitrates can work on arteries and veins, and thus the preload and afterload will decrease with these drugs. Okay, or the patient will be presented to you without cough, but with no improvement of symptoms after a week of the use of ACE inhibitor and beta blocker. He still complains of dyspnea, maybe worse, orthopnea, fatigue. So now you must add another drug, and the next drug to be added is spironolactone. Spironolactone is an aldosterone receptor blocker. That is, we will block this pathway at 2 points right now. The first one with the ACE inhibitor, and the second one with the aldosterone receptor antagonist, and that is spironolactone. This drug also improves the survival from heart failure, especially when used with ACE inhibitors and beta blockers. Now, the main side effect of spironolactone is gynecomastia and breast pain. This is because spironolactone is an androgen antagonist. It blocks the release of androgens, mainly testosterone, and it blocks its action. So the main reason for non-compliance with spironolactone is gynecomastia. And if the patient is presented with gynecomastia, you can shift him into another drug, and this is Eplerenone. Eplerenone is also an aldosterone receptor antagonist, but with no such anti-androgenic effect. For the more improvement of symptom, now you can add a diuretic, a loop diuretic, mainly furosemide. This drug can improve the symptoms by releasing the fluids out of the body. So this will decrease the preload and the load on the heart. Okay, with all these drugs, you must focus on potassium. You must check potassium level, because many of these drugs will increase its level. So potassium is the main electrolyte to be measured, although all of the main tests will be done to the patient, but you must focus on this in the exams. Now, if still the patient is not improving after the use of ACE inhibitor, beta blocker, spironolactone, and a loop diuretic, now we will add another drug, and this is Digoxin. Digoxin does not improve the mortality of heart failure actually, but it improves the symptoms. And the main mechanism of action, as a pharmacological point of view, the main side of action of Digoxin is the sodium potassium ATPase that is found in the heart muscle. Digoxin will block this enzyme mainly. Okay, most patients will respond with the use of these medications: ACE inhibitor, beta blocker, spironolactone, a loop diuretic, and digoxin. If the patient does not improve, surgical intervention will be needed mainly. For example, heart transplantation will be needed, and this is the end of the treatment of heart failure. Also, we can add the education of the patient. Exercise may be useful for him. Food must be regulated, and this is the end of the treatment of chronic heart failure.